Welcome back. Special guest with us this morning, Dr. William Barrow. He is with West Tennessee Neurosciences.
Okay.
Here to talk about stroke prevention. Tell us, what do folks need to know?
Well, the most important thing when it comes to stroke care is to call 911, get here early. We have a lot of treatments that are available these days for stroke, but they're very time sensitive. And the biggest problem we have in this country and the biggest contributor we see to the mortality and morbidity of stroke and the disability that it causes is delay in treatment. And so people waiting for symptoms to go away, people hoping that they'll go away, calling family members instead of 911. We can't help anyone until we're aware of them, until they get to us. And so the biggest problem we have is educating the public on the importance of not ignoring symptoms and getting here as soon as possible.
Symptoms. What are the symptoms? Could you be having a stroke? How do
Sure.
you know?
The most common symptoms we see: weakness on one side versus the other side, numbness on one side versus the other side, vision loss that's sudden, speech loss that's sudden, or just confusion. But what I tell people is any symptom could be a symptom of stroke, and if anything that comes on suddenly that's clearly different, call us, get to us, let us help you. It's better that you get to us and it turns out to be nothing, something that's not so serious, than you sit at home and ignore a stroke that we could have fixed had you been here sooner.
And lastly, prevention. What can folks do to prevent themselves from having a stroke?
Well, we certainly say the best strokes are the ones you never have. And so the keys to prevention are controlling your risk factors. Obviously, West Tennessee is very heavy in those risk factors, mainly high blood pressure, high cholesterol, diabetes. So if you have those conditions, make sure you see your doctor regularly, take your medicines like you're supposed to every single day. And most importantly, if you smoke, don't smoke. Smoking triples your risk of stroke and makes a lot of the medicines we use to prevent stroke much less effective. And so if you smoke, you must quit. Otherwise, we worry that you will have a stroke, not to mention your increased risk of heart disease, cancer, and other things.
All right. Thank you so much, Dr. Mayer.
Yes, ma'am.
We appreciate it. A wealth of information this morning.
Thank you so much.
Let's go ahead and check in with Gary.
Hey, everybody going to the Strawberry Festival Parade? You bet.